Bismillahirrahmanirrahim. Assalamu alaikum class. I hope you all are good in health. I'm your course instructor of the subject of gynecology. My name is Dr. Qurrat Ul Ain Nazar. And today we are going to start the second part of our chapter, which we have already discussed it previously. I have already uploaded the part 1 of common gynecological problems, and today we are going to cover the next part of the common gynecological problems. Before covering the basic points of the common gynecological problems, I want to review the last topics which we have already discussed, in where we have discussed the introduction of gynecology. I briefly introduce you that what is gynecology and what type of problems in gynecology women need to face, and then these problems are very necessary to be consulted with us specialist doctors. And then we also discussed something about gynecological health, that in gynecological health, it does not related with only the health of the fetus and the pregnant mother. It also includes some other health issues related with the reproductive system of the female. And then we also studied about the breast awareness, and we also studied that the what are the stages of these breast awareness. Further, after discussing the breast awareness stages, we have discussed these things in detail in FIGO model, where we can see that FIGO model how classify the metastasis and the problems in different stages. After discussing the awareness of the breast stages, then we will move towards the physical checkups, in which we will study that what type of what are the characteristics and what things are important in physical checkups, where women need to be very careful. For example, women need to be very careful in blood pressure checkups and in their pelvic examination, and not only on the blood pressure, they also need to be properly routinely check on the glucose level, where they need to monitor their glucose level through the urine test processes and HbA1c test. After discussing the physical checkups, we will discuss the cervical cytology, and we discuss cervical cytology in detail, where we will still see that basically cervical cytology tests are used to diagnose and used to indicate the any cervical tumor, and these tumors may be in different stages. So after that, we will discuss some of the gynecological disorders in terms of infections, and then we also studied that what type of infections these are. They may be fungal infections, they may be viral infection, bacterial infections, and so on. Then we also studied some gynecological disorders in the cyst formations, which are the polyps, and sometimes these cysts are painful and they can be removed surgically. Then we also discuss the disorders of the displacements and genital prolapse. And then we studied the infections of gynecological problems in detail, where we have studied the vulva, which is the vulvitis, which is the infection of the vulva. And then we also studied that how these vulvitis stages infections are further classified. And this classification is basically studied by the team members of the FIGO. And then we studied the infectious organisms of the fungal, where we have studied the Candida albicans and so on in bacterial organisms and in viral and parasitic infections organisms. Then we little bit study about the infections of the vagina, conditions of the vagina, and then what type of infections mostly vagina have. And this in vagina infection is called the vaginitis, and the infectious organisms for which is responsible for creating this vaginitis are the Candida albicans, Trichomonas vaginalis, Neisseria gonorrhea, and then Gardnerella vaginalis, and then Chlamydia trachomatis, etc. So after discussing the vaginitis, we discuss about the cervicitis, and in cervicitis we discuss the same things, that how the infections spread and how infection causes the problems in the reproductive system of the females. And after that, we will discuss about the endometrius, that what type of problems these endometrius actually created. And after we little discuss about the endometritis, which we going to explain which we're going to study today in detail. And then we also studied about the fallopian tubes, that how fallopian tubes problems led to the problems of self-angiitis, and ultimately if there is any problem which is linked with the fallopian tubes, and it may cause some types of ectopic pregnancies. After discussing the ectopic pregnancies which are linked with the fallopian tubes, we also discuss about the pelvic inflammatory diseases, and we have studied this thing, that how pelvic inflammatory diseases leads to the severe back pain problems, and sometimes these diseases also because of the pelvic symphysis pubis also. So we studied pelvic inflammatory diseases in detail, and we also studied some of the physiotherapy treatment roles in gynecological infections, where we studied that in acute cases there is no as such treatment of physiotherapy, but if we see in a prolonged cases, in chronic cases like pelvic inflammatory diseases and pubic symphysis pubis, there are some musculoskeletal problems which females need to be faced. And in this stage, physiotherapists, especially the women health physiotherapists, play a very important role. And we also studied that in different types of gynecological disorders, like if the gynecological disorder is at the level of the musculoskeletal problem, then these women health physiotherapists actually help us to recover from these type of issues. After that, we have discussed a very important disease, which is the AIDS, acquired immune deficiency syndrome. And I also um, uh, tell you that why this disease is written in the gynecological disorder, because sometimes this disease refers the problems to the newborn baby, and they also the fetus also suffer from this disease if mother is a victim of this disease. So after that, we also discuss some new things about the new malignancies in regard of the cysts and benign tumors, malignant tumors, and vulva, where we have also studied the stages of the FIGO, that how FIGO model describes the different stages in order to describe the current stage of the benign tumor, malignant tumor, cyst, and the vulva. So here you can see the vulvar cancer classification, and this classification is basically conducted by the Bettler et al., in which he studied the vulvar cancer in 4 stages, and then these stages are also subcategorized into substages. And then after, we also studied about the Bartholin glands, and we came to know that how inflammation, inflammatory ducts, and narrowing of the Bartholin gland is the cause of the pain of the reproductive system in pain. And sometimes the Bartholin gland blockage cause a very severe type of abscess and infections in the female reproductive tract also. After that, we will discuss the vagina in detail, where we have a little bit study about the vaginitis and other infectious problems which vagina need to face. After that, we have also studied about the uterus and cervix benign tumor, in which we will study the benign tumor stages in detail. And again, this model is basically presented by the Figo Bettler et al., in which he classified the malignant tumors in some stages, and these stages are also subcategorized into substages. For example, if you see in stage 1, this stage is subcategorized into 3 stages, and if you see in stage 3, this stage is already subcategorized into 3 stages, and likewise the stage 4 is also subcategorized into 2 stages. After that, we have also studied about the uterus in detail, and then fallopian tubes, that what type of infections and how this fallopian tubes led to the ectopic pregnancy. We have also studied a little bit about the ovaries, cyst, cancers, and then we have seen the categorization of the ovarian cancer, in which we have seen that how FIGO model categorize the ovarian cancer in these stages, in which we, in here you can see that these stages are further classified into four stages: stage 1, 2, 3, and 4, in which he classified these stages with the severity. After discussing all these stages of the cervical cancer, we will move towards our next topic, which is the endometriosis. So today we are going to discuss the endometriosis in detail. Basically, endometriosis is a condition, although not a cyst or a tumor, but has certain aspects that make it an acceptable illusions in the sections. So it is a disorder in which there is the presence of the endometrial outside the endometrial cavity. And there are so many kind of studies which are conducted about the endometriosis and endometrial problems, and these studies says, most of the studies says that pelvic endometrial deposits are found in the ovaries, peritoneum, sometimes the uterosacral ligaments, pouches of Douglas, and retrovaginal spectrum. Rarely there are extrapelvic deposits, and these extrapelvic deposits are found in the umbilicus and diaphragm. Basically, this deposition, this extrapelvic deposition in the umbilicus and diaphragm are the causes of the endometriosis in most of the female. And if we talk about the tissue, then the tissue which responds to the hormonal change of the menstrual cycle, it actually proliferates and may bleed at the upper point at this cycle. So the bleeding also sometimes causes the inflammation, and it may sometimes contain fibrosis, and it causes tract dents and adhesions. So these are the possible reasons of the endometriosis developments, and there may be a disproportionate level of the symptoms in comparison to the extent of the disease in women's pelvics. So there are so many studies which are conducted about the endometriosis, and it has been estimated that 10 million women in the USA and 2 million women in Britain suffer with this condition. So if we talk about the etiology, if we talk about the etiology of endometriosis, then we came to know that the exact cause of endometriosis is unknown, but there are several theories which actually tells us that the exact cause of the endometriosis is the infection, and sometimes the reflex of the endometrial debris and blood after the menstrual cycle through the fallopian tubes and into the peritoneal cavities actually causes the endometriosis. So this type of study is basically conducted by the Brent Coffold and Baculis, who actually concluded that endometriosis are basically the post-menopausal problems. And the another study also suggests that there are some chemical substances which are environmentally derived, and they actually act on one cell to the another, and they causes uterus infection. And these infection basically transferred into the endometrial cells, and later on these endometrial cells causes severe infection. And there is another theory which tells the etiology of endometriosis, and this theory is the immune deficiency theory. And what this theory actually says, it basically hypothesizes that women with endometriosis suffer from an immune deficiency such that the body does not reject and dispose the endometrial cells, and if they become displaced somewhere in the body, then they are the possible causes of the endometriosis etiology. So in etiology, we have covered the three basic theories. The first one is the transportation theory, where I discussed the reflex of the endometrial debris. The second one is the metaplastic theory, where I cover the differentiations of the endometrial changes. And the third theory is the immune deficiency theory, where I cover that some of the women have weak immune deficiencies symptoms. So if we move towards the second issue, which is the treatment, obviously there must be some treatment of this endometriosis, and these treatments may be pharmacological therapies, and then we also uh, mm, uh, used to know then also used to investigate these type causes of endometriosis, and then sometimes the surgery is also the best treatment of endometriosis. So if we discuss the first point, which is the pharmacological therapy, so we can see that NSAIDs, yes, NSAIDs, anti-inflammatory drugs, and some types of combined oral contraceptive drugs are also used as a first line of treatment drugs in the case of endometriosis. But these NSAIDs and combined oral contraceptives have some side effects too, like the bloating, fluid retention, breast tenderness, nausea, seborrhea, etc. So these type of issues also women need to face, along with the acne, muscle cramps, weight gain, and menopausal symptoms. So sometimes medical treatments report that 80 to 85% improvement rates for the symptoms, but efficacy is always dependent on the patient's ability, that how the patients tolerate the side effects of these therapies. After that, we will also need to investigate the exact cause and exact problem. Sometimes the women with this endometriosis presented with the pelvic pain, dysmenorrhea, and dysmenorrhea, which also have a transvaginal or abdominal ultrasound examination. So sometimes abdominal ultrasound examinations also be conducted for finding out the exact etiology of the endometriosis. And sometimes the surgery also referred, where laparoscopic diagnostic and surgery can be carried out during the same operation. So the laparoscopic surgery may be a conservative treatment, and it sometimes causes a fear in the female that these type of surgeries may exaggerate their problems, and maybe these type of surgeries are the cause of the infertility in the future. So most of the women deny this surgical procedures, but if this type of problems exaggerate, then this is the last possible treatment to cure this problem. So if we talk about the physiotherapy in the treatment of the gynecological cyst and new growth, so again we can say that as such, in terms of the gynecological cyst and new growth formation, as such, there is no place of physiotherapy, because there are important prophylactic and therapeutic roles, and these are the problems which should be treated under the prophylactic effects. So if patient did not demand any type of complaint of the pain, and if did not say that he is suffering from the musculoskeletal problems, then it is very difficult for a physiotherapist to treat the causes, because these causes are specifically the physician referral causes. So patient will benefit from advices and assistance to optimize. Yes, sometimes the physiotherapist may assist them, may advise them to optimize their physical and mental conditions. It means the role of the physiotherapist in these type of problems is just the counseling. Physiotherapists counsel the patient, but they cannot cooperate with the patient to the above level, until or unless the patient must be consult with some proper gynecologist. So after discussing the role of the physiotherapist in the treatment of gynecological cysts and new growths, we will move towards the displacements and genital prolapse. This genital prolapse is very important to understand, because most of the women face this problem of the genital prolapse. And the basically the word prolapse comes from the Latin word, and prolapse means the slipping forth. It means that there, in the reproductive system, in reproductive part of the females, there are some organs which actually slip. If we take an example, then the genital prolapse refers to the slipping of the pelvic organs into the displaced position. It means that the displaced positions of the pelvic organs basically tell us that there must be some genital prolapse in the female reproductive tract. So sometimes it may be retroverted prolapse, it may be anteverted prolapse. And for understanding the retroverted and anteverted prolapse, we need to understand the exact anatomy of the female reproductive system. So, if we move further, I wanted to tell the displacements of bladder also. If we talk about the displacements of bladder, then there are subcategories of the displacement of bladder. Why these displacements of bladder need to be discussed in displacement prolapse? Because it is sometimes the displacement of bladder which causes the whole genital tract of the women to be displaced. And if I talk about the displacement of bladder in the cytosol aspects, then it does not always affect continuous, but some patients complain of frequency and urgency of micturition and distress incontinence, which may be anything from very mild to severe. And there is another type of bladder prolapse which is called the retrocele. And in retrocele, there is another type of prolapse which is called the anterocele. And the both retrocele and anteroceles may result in the difficulty of defecation, and sometimes the patients with the bladder prolapse problems of the retrocele and anteroceles also suffer from the constipation and hemorrhoids. So if there is a concurrent urinary incontinence, it should be fully investigated before any surgery. So if you can see in this picture, um, let me, yes. If you can see in this picture, you can clearly see that these are the types of the prolapse, and where you can see the first type is the cytosol prolapse, which I already discussed, so that it is the prolapse of the bladder. And here you can see that how this cytosol prolapse shows that the bladder is actually comes very closer to the cervix of the female. And this is the retrocele prolapse, where you can see that bladder is actually closing the openings of the cervix of the female. And if you see in the C, which is the urethrocoel, you can see that the bladder is the female uterus is actually goes very away from the cervix. So these are some of types of the displacement and associated perineal appearance of the in regard to the prolapse. So let us discuss the anterior compartment with regard to this prolapse. As I have already discussed the anterior compartment prolapse, which is written in terms of cytosol, which means that the cytosol is the anterior compartment prolapse, and it is because of the weakness of the pubocervical fascia, which allows the bladder to displace downward and backward against the anterior wall of the vagina. It means if you see in this cytosol, you will see that the bladder actually displaces downward and backward, and it causes the vagina to push backward against the anterior wall of the vagina. So if this is lack, it will also protrude, and in more cases causes a pouch is formed. It means the cytosol causes a pouch of the vagina which is formed in the bladder, and it holds the residual urine, which represents a frequency and incomplete empty of the bladder, which predisposes to infection. The second diagram you can see is about the urethrocoel. Yes, after discussing the eighth part of the figure 9.1, I will move towards the C part of the figure 9.1, where you can see that urethrocoel is written in C bracket. And what is urethrocoel? Basically, in urethrocoel, the urethra alone being closely attached to the anterior wall of the vagina, and it causes sometimes may sag backward and downward when it receives insufficient support from the vagina and the surrounding fascia. So it may also kink, and it is the least common form of the genital prolapse. And basically this urethrocoel study is conducted by the Thacker and Stanton. After discussing the urethrocoel and cytocele, there is another prolapse of the bladder, which is also called the cystourethrocoel. And basically, cystourethrocoel is the combination of cytocele and urethrocoel, and it is the most common type of prolapse in most of the women. And cystourethrocoel may be associated with urinary stress incontinence and urinary retentions, and sometimes recurrent urinary infection tracts, and sometimes the patient may suffer from both the urinary retention and urinary tract infections also. So I hope you clearly understand the anterior compartment of and in which I have explained you the cytocele and urethrocoel in detail. After that, we will move towards the middle compartment, and in the middle compartment, we can see the enterocoel. Yes, in the middle compartment, there is a prolapse which is called the enterocoel, and basically, enterocoel is the adjacent of the vaginal wall frees the upper part of the posterior vaginal wall to drop, bulge and protrude. It means it allowing an extended pouch of Douglas to be herniated, and it may contain small bowel and omentum sometime. Thus an enterocoel usually accompanies a uterine prolapse. So, after discussing the these compartments, we will move towards the second definition, which is the uterine prolapse. First of all, I want to show you this diagram, and if in this diagram you can see that there are some degrees of uterine prolapse. If you see in the first degree, you can see that this is a slight uterine prolapse. But if you see in the second degree, then this uterine prolapse extended towards the wall of the bladder. And if you see in the third degree, then you have seen that the whole bladder comes out from the your reproductive tract. So these are the 3 degrees of the uterine prolapse. And in detail, if I explain you this uterine prolapse, then if you see the first stage, you can see that the cervix remains within the vagina. It means that it is a very mild prolapse, but in the second degree, adjacent of the cervix to the introitus may protrude further on straining, with the possibility of damage, infection and ulceration. And if you see the third degree of the uterine prolapse, it is also called procedentia, and the entire uterus in third degree descends outside the introitus of the body and causing total inversion of the vagina. So a procedentia is almost inevitably associated with the cytocele and an enterocele. So however, it is now recommended that gynecologists should use the parameters for measuring pelvic organ prolapse, which is described as bump et al. In this study. So sometimes uterine prolapse is associated with the severe backache, and sometimes they also have difficulty in using tampons. So placentra may lead to the ulceration. It means the females having a third degree of the uterine prolapse having a great difficulty in masturbation and also have some common problems regarding with their back pain. So after that we will move towards the posterior compartment, where we will see that posterior compartment in figure 9.1 section B, you will see retrocele. Yes, if you see the retrocele, you can check that it is the prolapse of the rectum forward against the lower part of the posterior wall of the vagina and is almost always associated with the damage to the perineal body and consequent loss of the support it is actually providing. So inadequate or insufficient suturing of the episiotomies or perineal tear are actually linked with the childbirth, or lack of appreciation of the damage sustained may sometimes contribute to these conditions. So these are the grades of the genital prolapse and the uterine prolapse. I hope you understand well that how these prolapse are basically divided into compartments, where we have studied the anterior compartment, middle compartment, and the posterior compartment. And we have seen that how these retrocele type of prolapse links with the posterior compartment and so on. And we have also studied about the uh, uh, uterine prolapse also. So next topic is the physiotherapy in the treatment of genital displacement and prolapse. So what do you think? Is there any role of physiotherapy in case of the genital displacement and prolapse? Again, the study says that as such there is no role is proven, but most of the females complain back pain, back problems. They suffer severely from these type of problems. So what can they do if they suffer from these type of problems? They need to take a proper advice from the physiotherapist, and then the physiotherapist may help them for getting some strengthening of the pelvic floor muscles, and they may also help them for strengthening the core stability of the back, and it may sometimes also improve their problems. Especially it may also sometimes relieve the pain of the women with the genital prolapse. Further studies also suggest that sometimes female physiotherapists suggest type of positions. Yes, postural positions sometimes also important, and postural positions sometimes also help the women in getting the relief from the pain of the genital prolapse. And further, there are some gynecological conditions with the relevance to the physiotherapist. Okay, now let us study that if there are some gynecological conditions which women physiotherapists need to be treated, then what type of problems they are. So the disorders which are associated with menstruation. Yes, there are some disorders which actually linked with the menstruations, which are the menarche, primary amenorrhea, secondary amenorrhea, dysmenorrhea, primary or spasmodic dysmenorrhea, and secondary or congestive dysmenorrhea. These are some of the problems which sometimes female physiotherapists help the patients to recover from the pain, to recover from the physical pain, and to recover from the physical discomfort. They also suggested and they guide sometime the appropriate positioning, the relaxing therapies, which actually helps these females to overcome from these type of problems. So let us discuss these terms in detail. If we take an example, if it of the menarche, then actually the menarche is the onset of menstruation at the median age of 13 years. 13 years is the average age of a female in which they may started their menstruations. So during the menstruation, most of the teens girls get confused and they have fear, and they were not accepting this natural physiological process. So in this aspect, the society, the mothers, and the other health workers also help these girls so that they can overcome the fear and the discomfort problems of the menarche. And after that, female also have the problem of the primary amenorrhea. Primary amenorrhea is actually a condition where the female uh, is actually developing some secondary sexual characteristics, but she have amenorrhea. It means there is she did not get her menstruations in the age which she is expecting. So this is the primary amenorrhea, and sometimes these women need to be checked by the gynecologist that there may be some type of weakness due to which their menstruation cycles are delayed. And then if we talk about the secondary amenorrhea, then it is strictly defined as the absence of menstruation for 6 months in those women who have previously menstruated. It means the women who actually started their menarche, but after the starting of the menarche, suddenly they found the absence of menstruation, and these as absence of menstruation is maybe due to the emotional stress upsets and regular strenuous exercises. So first of all, we need to find out the exact cause of the secondary amenorrhea, and if the woman is free from any type of stress, emotional upset, and regular strenuous exercises, then these women must be consult with some physicians, because if this type of secondary amenorrhea is cannot be treated, then it may occur with some serious illnesses, starvations, anorexia nervosa. So women need to be very careful in order to getting their periods times in time. So after that, we will discuss the dysmenorrhea. Dysmenorrhea is basically a Greek term, and it is known as the difficult monthly flow, and it is also described as the pain associated with menstruation. This thing we already covered in the first chapter of gynecology, where I classified these type of amenorrheas, dysmenorrheas in detail. And we have seen that if a female have a painful menstrual cycle, then this term is known as the dysmenorrhea. And then there is another type of dysmenorrhea, which is the primary and spasmodic in structure. So this is the more common type, and it is related to the increased production and release of endometrial prostaglandins, which results in increase and abnormal uterine activity. So this increase and abnormal uterine activity are the cause of pain in the lower abdomen and the sacral region in the first hours of the period. And if we move towards the second type of the dysmenorrhea, then this is the secondary and congestive dysmenorrhea. And this secondary and congestive dysmenorrhea is basically associated with some structural abnormality or pathology, and these pathologies may be in the form of the fibroid, endometriosis infections, the pain which may be unilateral or bilateral, and it begins with 3 days before menstruation and is relieved or temporarily exacerbated as bleeding commences. So it may also increases with the activity. The physiotherapist must assess some referral with cares. After that, there is a problem which is called the breakthrough bleeding. What is the breakthrough bleeding? If simply I explain the breakthrough bleeding, then it is the described as the intermenstrual bleeding, which is actually associated with the use of the contraceptive pills. It means IUCD devices and the contraceptive pills are the cause of the breakthrough bleeding. After that, we have a tension which is related with the premenstrual tension. What is premenstrual tension? Premenstrual tension is very common in women over the age of the 30 years of age. It means that younger women face this problem of the premenstrual tension, and basically it is diagnosed with the irritability, depression, sometimes the lumbar back ache, tenderness and enlargement of breast, abdominal pain, distensions, water retentions, weight gain, insomnias, and sometimes the hormonal dysfunctions are linked with the premenstrual tension. It means that in premenstrual tensions, women face lots of problem of their hormones. Women sometimes face the problem of the weight gain, the also with the breast enlargement. So these type of changes, these type of physiological changes which women face after the age of between the age of the 13 to 30, she may occur with this stage, which is called the premenstrual tension. After that, there is another gynecological disorder which is called the dysfunctional uterine bleeding, menorrhagia. As we have discussed the term menorrhagia in detail, where we have studied that what is menorrhagia. So if we linked menorrhagia with the dysfunctional uterine bleeding, then basically it is the term which is used to describe the abnormal uterine bleeding, not due to the organic disease of the genital tract. It is the most common frequent encountered condition in gynecology, and it occurs at any age, but it is also a sign or category of the disease. So sometimes girls need to be very careful if they cause any type of problems related with the menorrhagia or these type of pains. So after discussing this, there is a term which comes under the domain of the physiotherapist, and sometimes physiotherapists need to be very careful in treating these type of problems. These are the backache and abdominal pain problems. And in backache and abdominal pain problems, women's mostly have pain at the pubic area. If you see in this picture, you will see that women most of the time have anterior pain in the marked area, and they have posterior severe pain in the marked area at the level of the symphysis pubis joint. So this is not always so much needless additional suffering to be avoided by appropriate physiotherapy assessment and care. But back and abdominal pain type of problems need to be mentioned, and women also be very careful in treating these type of problems earlier, and they may take counsels, and they may take consultations with the women health physiotherapist. After that, we will move towards our next problem, which is also linked with the back pain, and this problem is the abdominal lower back pain. Yes, if we talk about the abdominal lower pain, that most of the women have the signs of abdominal lower back pain in their uh, periods. When they have periods, the first 1 to 2 days of their menstrual cycle is actually very painful, and they may feel pain in the lower abdominal area. So this is the acute lower back pain. Sometimes the women also feel pain in an ectopic pregnancy. If a woman have a symptom of ectopic pregnancy, then she may also complain that she is having pain at the lower abdominal area, where she says that her anterior superior iliac area have a rare and a very severe pain. So this type of pain actually indicate that women have issue with her back, and women have maybe some have issue with her pregnancy. After that, we will move towards the another, which is the chronic abdominal pain with pelvic congestion. If women have chronic lower abdominal pain, it means women have chronic severe back pain along with the pelvic congestions. That in this case, women also need to be very careful. In chronic lower abdominal pain, in pelvic congestions, the pelvic pain in women of the reproductive age with no obvious somatic pathology. It means it is not necessary that women have some somatic pathology for developing this chronic lower abdominal pain. Sometimes the women give birth to a multiple babies, and after giving birth to a multiple babies, she already have mineral deficiency. She is a victim of the osteoporosis, and she is also the victim of the anemia, and she have some postural changes. So these are the suspected possibilities of the chronic lower pain development in women with pelvic congestion. So after that, we have very important term of, of gynecological disorder which need to be discussed in detail is the polycystic ovarian syndrome. This polycystic ovarian syndrome is the most common disease, you can say is the most common syndrome which most of the females faces. And this polycystic syndrome not only have some secondary characters, it also have the primary characters. It appear directly on the women's health. It badly affects the women's physical and mental health also. In this polycystic ovarian syndrome, we have seen that the women also suffer with the problem of the hirsutism, acne, obesity, with the increased testosterone activity and elevated LH concentration. So these elevated LH concentrations increase testosterone activities characterize some of the male characters in the female, in which one is the hirsutism, which is the unwanted hairs in the face of the female. So these type of problems are very distressing for the females, and sometimes they come under depression if these type of syndromes cannot be cured. For the curing and for the treatment purpose, the women should consult with a proper gynecologist where they advise them for having a hormone therapy in which she can take properly hormone androgen, ovarian androgen production therapy, and these type of problems can be cured very soon. After that, there is another major gynecological disorder which in the society and it is the infertility. Infertility is further subcategorized into two, which is the primary infertility and secondary infertility. Infertility is very clear to understand. It means that the woman is not able to conceive. If a woman is not able to conceive, then this leads to the infertility. It means the woman is infertile, and this may be due to the so many reasons which we have already discussed, in which we can say take an example of the infection of the fallopian tubes. If the fallopian tube salpingitis is not treated properly, then it may lead to the infertility to the women. And what is the primary infertility and secondary infertility? Primary infertility means the woman did not conceive once in her life. It means she don't have any baby. And the secondary infertility means once previously the woman conceived, but after she conceived once, she will not able to conceive in the second time. It may be due to some of the complications which women may suffer during her first pregnancy. So these are the types of the infertility. After that, there is another disorder which is called the premature ovarian failure. What happens in the premature ovarian failure? It is also known as premature menopause. It means this is a distressing condition for most of the women when the menstrual cycle cannot be treated and managed properly. The ovaries fails to occur, fails to conceive, and it may also and it may be between the age of the menarche towards the age of the 40 years. So if women did not have a proper menstrual period during her age, starting from the menarche over the age of the 40 years, then the incidence in these type of women are very common. Sometimes the gynecological surgeries, chemotherapies, radiotherapies are the fruitful treatments for this type of POF. But commonly it is seen that these type of problems cannot be cured. And these women mostly have the problems of the osteoporosis and heart diseases. After that, there comes in another problem, which is the psychosexual problems. Yes, this is also the female gynecological problem. It is a disorder in most of the females, and women's health physiotherapists must be prepared for the clients to want to discuss their sexual difficulties. Sometimes the women face lots of psychosexual disabilities after the birth of their first baby. So, in that case, women health physiotherapists and the midwives must counsel the female. They first find out and assess that what the problem women is facing. Sometimes the woman is facing the problem of the incontinence, and sometimes after her first pregnancy she may suffer from the weak pelvic floor muscle. So these type of problems must be treated. So these are the expected gynecological disorders. Along with these disorders, there are some other disorders which I expect you to study, like there are these are basically the etiologies of the psychosexual problems, and these etiologies are the predisposing factors, precipitants, and maintaining factors. After that, if I move towards the other gynecological disorders, then there are some general sexual dysfunctions. In general sexual dysfunctions, sometimes the women lack the interest of sex. Sometimes the women have an increased amount of testosterone, and this is the reason that women actually lack the interest from his partner. So after that, there is another type of dysfunction, which is the orgasmic dysfunction. In orgasmic dysfunction, woman is unable to feel the pleasure of the sex. And then there is another type of dysfunction, which is the vaginisms, dyspareunia, and this dyspareunia is further classified into different types, and basically this dyspareunia is due to the vaginal and vulval infection. Yes, dyspareunia is basically occur in most of the females due to some diseases, due to some damage, or due to some infections. And these are the causes of the superficial dyspareunia, which are the vaginal and vulval infections, damage sustained during childbirth, menopausal changes due to the estrogen deficiencies, which give rise to atrophic vaginitis and narrowing of the vagina. And sometimes the superficial dyspareunia is due to the urethritis, congenital conditions such as rigid hymen and vaginal stenosis, and sometimes it may be due to the inadequate genital lubrications, irritants such as spermaticides and latex, radiotherapy, and sexual trauma. After that, the female may also have a deep dyspareunia, in which she can feel the acute and chronic pelvic inflammatory diseases. Sometimes she suffers from the endometriosis, ectopic pregnancy, retroverted uterus, prolapse of the bladder, uterus and the rectum, and sometimes she also had the prolapse of the ovaries into the pouches of Douglas. She also had some post-operative scarring following the vaginal repair. She also suffered from the constipation, neoplasm, gynecological pelvic and abdominal surgeries, post-operative adhesions, and sometimes the fibroids. So these are the causes that women sometimes suffer from the deep dyspareunia. Yes, there are some possible treatments of the dyspareunia, and in the treatment, some pharmacological treatments also be taken. And if pharmacological treatments are not cured these type of primary and secondary dyspareunia, then surgery sometimes help to recover from these problems. After that, we will have another term which is called the vulvodynia. And this vulvodynia is further classified into dysesthetic vulvodynia and vulvar vulvodynia. So if I simply explain the vulvodynia, then it means that the distatic vulvodynia is the condition of the abdomen abnormal pain syndrome, which is similar to post-therapeutic neuralgia. It means that distatic vulvodynia is a condition which is similar to the acute abdominal pain. And in vulvar vestibulitis, it is the pain which is usually felt in the vaginal detritus from the clitoris to the fourchette to any degree of the touches. Yes, there is also a treatment of this vulvodynia, and these treatments are sometimes the local analgesic creams and sometimes the ointments. And if these local analgesic creams and ointments are not be helpful, then some medications, oral medications, can also help to overcome the problem of the vulvodynia. Then comes the sexuality in pregnancy. Later studies suggest that sexuality in pregnancy in the third trimester is harmful. The couple need to avoid from the sexuality in pregnancy in the third trimester. In the puerperium, we have studied this thing in detail when we have studied this chapter of the puerperium, in which we have studied that female sexuality is often adversely affected in the puerperium. It is the infection, it may be due to the infection, it may be due to the any prolapse or any type of abnormality in the puerperium. But female sexuality in the puerperium is adversely affected. And there are probably multiple reasons for this, including the perineal trauma, hormonal readjustment, fatigue, psychological causes, which includes the anxiety and the depressions. After starting the perineum, we will move towards the premenopausal women. Yes, there is also a condition in the premenopausal women, and what happened in the premenopausal? In the late 40s, the women are achieving much in their professional lives but also having to cope with children growing into the young adults, elderly parents, and their own bodies starting to show some signs of deterioration. So, women actually negotiate the effects of the sexual desirements, and these are the expectations of a healthy sexual life, that women must be active in their sexual environment, sexual relationship. But due to the overburden of the responsibilities, women neglect herself, and these are the causes of the osteoporosis in most of the females in their very, very early lives. Yes, after that we will move towards the next factor of the gynecological disorder, which is the climacteric. Shortly, I just say that sometimes there are several factors other than the body chemistry that can influence sexual fulfillment at the time of the climacteric. And these climacterics includes the satisfaction within the relationships, emotional stability, and psychological well-being. Yes, these type of relationships are very important in the climacteric. If any couple, anyone from the couple lack from this satisfaction, lack from this emotional stability, then their climacteric changes, and they ultimately lose the attention, lose the attraction towards the sex. In the end, the older age, yes, older age, most of the women live one third to one half of their life after the menopause. So more people of both sexes are reaching their 70s, 80s, and even 90s, and many are in very good health. So the continued sexual activities and enjoyment will be possible for the money. But sometimes neurological damages and other physical disabilities may affect to the both the partners. Now, there are some psychological and emotional implications of the gynecological disease. And these psychological and emotional implications we have already discussed in the climacteric, that what happens in old age, what happens in the climacteric. So these all factors badly affect the psychological and mental emotional conditions in the gynecological health of the females. If we discuss about the sexuality and the body image after cancer, if we talk about the sexuality and the body image after cancer, then most of the people survive treatment for their malignancies. And after the treatments, they have many emotional and physical changes, and this can really affect their sexuality and sexual function relationships. Especially the women who undergone the breast surgeries, these type of patients may be concerned about their own body image. So it is common for the women to have difficulties with the sex and intimacies after their diagnosis. So this may be a fear that their partner will find them less attractive, and practical issues of discomfort in positioning for sexual activities and lost libido after the chemical menopause. So these are some of the psychological distresses which can actually bring about hormonal changes, and they cause more psychological distresses. So it has been also found that most of such issues were resolved by 1 year after the surgeries. So this is all about today's chapter of gynecological problems, and I hope that you understand well. If you have any query regarding this chapter, you can WhatsApp me and you can ask me. So for today, Allah Hafiz.